Hello everyone. This session is mainly designed to give awareness about a psychiatrist and psychiatric patient and the treatments available with psychiatrists. So nowadays most of the people are having misconceptions like only the people who are mentally ill, the mental people will approach a psychiatrist, and nowadays people are actually scared to approach a psychiatrist. So I would like to avoid all those misconceptions and give the right way, right information about a psychiatrist. So this session is mainly designed about that. So let's start the session. So, who actually is a psychiatric patient? A psychiatric patient can be a children or employee or older people, elder people, or any youth. So, this disorder, the mental illness, apart from the physical injury or physical diseases, any kind of mental illness is called as a psychiatric patient. So let's see what are those symptoms. What are the symptoms in children and what are the symptoms in employee and elders, etc. The symptoms in children are like school phobia and academic backwardness, just like they won't perform well in their studies and they will be having a lack of focus in their studies, and people are actually very dull in any time, and who is having a homesickness and who is having a performance disorder. They actually every time they will be scoring very less marks in their exams. All this kind of illness, this kind of disorders or phobia, they're mostly we can able to see in children. They has to their parents have to approach a psychiatrist and then get a right solution. So this is about children. And coming to the employees, nowadays most of the people are having work stress and family stress. Due to this kind of stress, people are actually having a depression. We are able to see all this kind of stress in most of the employees, and they leads to depression. And in some people we can able to see a suicide intention and a personality disorder, and they will be having improper timings they will work, so finally it leads to sleepless nights, and they will be having a negative thinking and anger, dizziness, stigma, and anxiety. And some people will show their emotions in their work as well. And some people are having depression, and some people are having addiction about alcohol, drug, and smoking, and any kind of financial stress. The depression may be due to financial stress or family stress or work stress or any bipolar disorder or hysteria and taking long leaves, or any kind of these symptoms are available in any person, they will be called as a psychiatric patient. So these people also have to approach a psychiatrist and to get the right solution and to lead a happy life. A World Health Organization says who actually is a healthy person. Healthy person is not like everyone think like I don't have any fever or cough and any kind of problems, so I'm healthy. So that is actually the thinking is wrong. World Health Organization says who actually is a healthy person is the person who is physically, psychologically, socially, and spiritually, all these factors are healthy. The person who is healthy among all these factors, they will be treated as a healthy person. That's what World Health Organization says. And coming to the causes of psychiatric problems, why the psychiatric problems are high nowadays? The main cause is due to lack of awareness about psychiatry. As I said earlier, most of the people are having misconceptions. They treat like they're actually scared to approach a psychiatrist. What other people think about me, and only mental people will approach a psychiatrist. These kind of misconceptions are more nowadays. And also one of the another causes, psychiatrists are actually minimal compared to the other specialization doctors. So these are the main causes of psychiatric problems. And coming to the difference between psychiatrist and psychologist. So few people may be having a confusion about these two. So I would like to clarify both. So who actually called as a psychiatrist means um, they will complete MBBS. MBBS they will complete, and they are actually doctors, MBBS doctors. After that, they will do a PG, MD or DPM, and they actually diagnose the patient and they will give a treatment with prescribed medicines. They will be called as a psychiatrist. They are actual doctors. And coming to the psychologist, psychologists are not actually a doctor, but they will do a actual degree like BCom or BSc. They will do actual degree, normal degree, and then they will do PG in psychology like MSc psychology or MA psychology. So they are not actually doctors; they are just counselors. They won't be treating the patients with medicines and all. So they will just counsel the patient and they will suggest them with the right solution, or they will ask them to approach a psychiatrist. So this is the main difference between psychiatrist and psychologist. And coming to the benefits of approaching a psychiatrist. So how do people benefit by approaching a psychiatrist? The benefits are they will improve our conjugal life or social life. Conjugal life means a few people may be having sexual disorders, and few people are not, they will not mingle with other people. uh, they are actually very dull and timid, and then they will sit alone and uh, they will be indistinct with other people. So any kind of this type of disorders will be there. To overcome all these kind of problems, people has to approach a psychiatrist. So the first benefit is to improve their conjugal life or social life, and the second benefit is to control from social attractions, temptations, or emotions. As I said earlier, nowadays people are having more temptations. Most of the people are having temptations and social attractions, and they are very emotional. So all these kind of problems will be they will overcome from all these problems by approaching a psychiatrist. And the third benefit is alcoholic or drug de-addiction. As I said earlier, most of the people are addicted to drugs and alcohol, and it leads to their family will actually suffer. Due to one person, entire family will suffer. So to overcome from all these addictions, so they will have alcoholic and drug de-addiction. And the next benefit is to overcome all the misconceptions and false beliefs. They has to approach a psychiatrist. And the main benefit is the psychiatrist will offer a solution to their mental illness. So these are the benefits by approaching a psychiatrist. And coming to the treatments of psychiatric problems, what kind of treatments are available with a psychiatrist, and how they actually treat the patient? So let's see that. The treatment is based on a severity and impact. First, they will diagnose the patient and what kind of severity and what type of impacts are there due to their problem. If their problem is mild or minor, it's a minor problem, then they will just send the patient to a counselor, and then they will just counsel them as per 2 3 counseling sessions, and then they will give a solution to the patient. And if the if the disease is major, if the disorder or illness is major, then they will find the right therapy. There are multiple modalities are there in therapy like CBT, REBT or elliptical therapy, and short term therapy, brief therapy. Any kind of they will identify a proper therapy. As per that, they will diagnose, and then they will give a right medicine, and they will give a solution to the patient. So these are the treatment, how actually psychiatrist will treat a patient. So there is no need to worry to approach a psychiatrist. Don't scare, don't get scared, and don't scare other people to approach a psychiatrist. So if you want a healthy life and a happy life and peaceful life, you have to approach a psychiatrist. There is nothing wrong in approaching a psychiatrist. We are in a modern age, we are not in an ancient age. So good. If you are having any kind of these problems, whatever I discussed with you, if you are having, or your children is having, or your family is having any kind of problems, just approach a right psychiatrist and then find a right solution to lead a happy life. So that is what for today. Thank you all for joining. We'll meet in the next class.